Medical Dilemma.
Hello, my name's Sunny Del Rosario. As we go along, got you, no? Carry Tambuatco, as you well know, but I'm not doing politics, we're doing medicine today. And we're going to talk about the dilemma, the issues that confront us. Now, in the first part, we were talking about, we have two experts here with us. We have Dr. Belen Rajagukguk, and we also have her daughter, we have Irma, Dr. Irma. What I failed to mention is they're both from Seventh-day Adventist. So I guess I'm going to start out the dilemma. Before anything else, we have also Father Jerry Manlangit, who is our bioethicist, and we have Dr. Sanchez, who is both a doctor and a legal expert. Hello, everybody, and thank you for being on the show. Let's go straight to the issue. Nakakabangga ba yung Seventh-day Adventist religion nyo? Does faith and medicine have a dilemma or no issue at all?
With regards to pregnancy and
I guess,
contraception,
yes.
no issue.
No
for
issue.
contraception.
In other issues,
So
just
it's
in
the same,
case. Yung mga iba, cancer, death, yung mga wala ring issue. So walang problema talaga whatsoever. Okay, it's your call.
Yeah. That's why we asked them about abortion, Father, di ba?
There
Do
is
you
a lot
do
of issue.
abortion?
Here we go. Let it
Oh,
rip,
si Father na
Father.
lang.
Of course.
Lot of issue pala.
Of course. Because when we talk about contraception, then you talk about interventions which you know very well are quite contrary to the nature of sexuality and to the nature of having children.
Right.
And when the issues about having children, having contraception, and how well you are going to practice them, a lot of issues will come in. Precisely where, for example, the reproductive health took a long discussion and took a long conflict between the church and the legislators because of those issues.
But we all know who won. The pharmaceuticals won. I mean, habang nag-aaway yung legislatura, tsaka mga doktor, mga
That's another
experts.
issue.
Ano po yung isa?
That's another issue.
Well, Santo Papa sabi, no go. But the president is not Catholic. That's why it was approved.
But I
Go
have
ahead.
a question here, no? You being Seventh-day Adventist, were you asked or notified also to join in Congress to put in your 2 cents worth about this RH bill? What do you
No.
think?
They were not
Your church was
invited.
not notified.
Right.
It's Catholic lang.
We are,
Or not
the
even.
Catholic Church is in the forefront.
Oo, nangunguna yung Catholic
It's
Church.
always in the
Kasi
forefront because
Against
of the
Against.
moral issues.
moral issues.
Because of the moral issues that are always there, intrinsic to the
The moral
to the
issue
discussion.
being no to population,
No,
or
not
man
really.
should
no
not,
contraception.
should
well,
not, and
Except
no to
natural.
contraception.
Except
it's not
natural.
only no to the use of contraception, but because of a deeper issue that is there, which is the control of population.
Man should not legislate to control population because our religion, our faith being Catholic says that go and procreate.
Not in itself. Because there are many ways to control population, and we are only advocating that
But
which
that-
is moral.
We're already doing it. The Middle East is bringing down Islam. They're shooting each other. Diba? So that's population control. Here,
That's
we've got the
killing.
Mama Sapano. All we
That's
need to
killing,
keep the president there. And we'll
That's killing.
shoot some more.
Right.
Diba?
That's killing and
Sorry,
murder.
I'm quite political, but I mean it to be comedic. Father, go ahead.
Contraception is contra-conception.
Contraception.
Like, for example,
Contrary to conception. So they are going to use a lot of any tools or chemicals or pharmaceuticals or any other kinds of intervention in order to fight, to stop conception. That's why it's contraception.
well, basically, as a rule, contraception, abortion in any form is illegal in the Philippines.
Of course.
Actually, if you do active intervention. But if you want to prevent pregnancy, that is allowed. I recall now, with regard to our crisis, the Zika virus.
yung lamok.
What is
yung
that? I
dengue.
think I heard that they were trying to legislate or prevent people from getting pregnant. Is that
I mean,
true,
is that
Harry?
possible? I read in the major dailies and The Economist as well as international news presentations. Do not have children between 2016 to 2018. Now, is that even possible? I mean, the Latin Americans, you're talking how many hundreds of millions of people. Di ba? I mean, kayo, mga doktor, ang mangyayari niyan, doktor, buntis ako para sa China. Pwede ba pumunta sa likod ng bahay niyo, doon na lang ako manganganak? Kasi bawal eh, di ba? Because of the Zika virus.
What is the Zika virus anyway? Why is it so important in pregnancy?
Well, it is high in South America, and it is transferred by mosquitoes.
Yes.
And
The
there
same
is
as dengue, no?
statistics
Yeah.
of microcephaly, babies with small head, has increased, dramatically increased. That's the reason why they advocated that for 2 years, the women there should not have babies.
When a baby has a small head, can you identify this problem upon birth?
Yes,
Or-
yes.
Paglabas kagad, alam mo
Or
na
yes.
kagad.
sa
nakita?
ultrasound pa lang, sir.
So bago pa lumabas
Pre,
ang bata.
preconception.
Dilemma,
Ano, not
father.
preconception,
It's a dilemma
pre-delivery.
because
Kung alam natin,
there's so many people who know that if a child has deformities or a child is sick,
Abort.
something like that, they abort.
Abort.
And that is where the moral issue. The fact is, just because a child is deformed, he does not have any right to live, does not have any right to see the beautiful world,
light
does
of
not have
day.
any right to be born. That is a big
But that's
dilemma. It's a moral issue.
But it's a severe handicap.
There are people who
Severe.
have severe handicap. There are so many people who have severe handicaps, and yet they are great people.
But what about this?
Beethoven was there from the very beginning.
Correct.
He became a very great musician.
Tama.
But in this case, because there's an effect on the brain, what is the prognosis of the child? Will he be compatible with the regular life or what?
Hindi pwede, hindi kaya.
Mamamatay
Yeah.
din or what? More or less, as far as you...
Usually po, doktora, if it's microcephaly, it's a severe brain
Yeah.
atrophy.
What
So
do you
they would
recommend
not
pag
they
ano?
would not survive most
For
of
how
the
long?
time.
Okay.
How long?
More or less. They can get
It's
it.
hard to say.
Oh, they can
but
be born. You can see a lot of pictures there in the newspapers
So-
and even in the CNN. There's a lot of babies.
When confronted with that dilemma, what do you do? Do you allow,
Supposing
what
the
do you
parents
promote?
ask
Yeah.
a request that you
What do you tell the
terminate?
parents?
We
abortion.
advise, not
Abortion
abortion,
is
but
not allowed. We do
we
not-
advise
Yes, it's also
contraception
illegal
in this
here.
area. That was the
Oh, but
advocacy.
If you're confronted with an issue and you have a patient that comes in, at alam mo, through prognosis and through diagnosis, whatever, with all the technical equipment we have today, this kid has that problem.
We are not allowed in the Philippines to do abortion. That's a stand
So,
already.
Even that one, how can you even do contraception when you do not know yet that you're going to get married, out to get pregnant?
That's right.
The only time that you can, that you will
you're
know
already pregnant.
that you are pregnant with a microcephaly baby
After the
is
fact.
after when you're already pregnant.
When
How
you're
can
already-
you contracept that? So people who are very radical would abort. And that is crime in the Philippines.
What's our position on contraception sa simbahan?
Still
Go ahead,
no.
Dr. Belen. You're saying, because you're our guest, please speak up.
The reality actually in the Philippines is that 3 out of 4 mortalities in the Philippines are from young pregnancies. And 3 out of 4, that's very high. That's the reason it is our objective that we help these young people
That's
not to die.
Oh, not
we
to
have
die.
to die, because when they get pregnant, they will belong to the 3 out of 4 mortalities in the Philippines.
Contraception is very closely linked to education. Correct me if I'm wrong.
Of course.
If
A lot of problems will come because a person
Education.
is not educated. And even our country is still very poor because not everybody is educated. They do not
shame
know-
on the
They
DepEd.
do not know how to vote.
Yes. Hindi alam. Kulang.
Kulang.
Hindi,
They do
kasi
not know how.
that statistics, 3 out of 4, 75% mortality, when it comes to pregnancy. It's horrible.
Young pregnant
Young
women.
pregnant. Pag sinabi mo young, what age? Till what age?
16 up to 24?
That's horrible.
That's yes.
So,
So,
yun ang pinakamataas na porsyento natin ngayon, those that are susceptible to pregnancy.
yes.
Opo. I have one horrible experience.
Please share
When
it
I
with
was a third-year resident, this happened in a government hospital where I rotated. This was an 18-year-old pregnant person who came in from Laguna, I think, or Cavite. And then, palipat-lipat na po siya. Siguro 3 or 4 ng hospital
But ay kunin.
na kasi wala siyang prenatal care, 18-year-old, palipat-lipat na po siya. dumating siya dito sa hospital na nandoon ako naka-duty. Puno na po ng tubig ang baga. May pre-eclampsia, yung hypertension in pregnancy. Hindi nila alam. It happens. And so we had to deliver the baby. And then the husband was also young. And bad yung ending ng story. Namatay po yung mom sa table.
Oh my God.
So how can... And then I was the one tasked to tell the
Parents. Yeah,
the
husband.
mom and the husband. So after that, I said, kailangan talaga ma-educate sila at saka maprotektahan ang sarili kung hindi pa po ready magbuntis.
Is that government's fault, Father? It
Not
is, isn't
really.
it?
Well, it's multi-pronged.
Dapat social nets.
one,
Gobyerno.
oh, yes, the government is there because they do not have good programs for prenatal.
You're confusing me now. Pag sinasabi mo prenatal, di ba check-up lang yan? Yan ang pagka, as a, it's nothing but a check-up. So,
Check-up po, but prenatal
Check-up.
check-up is really important because when you do regular prenatal check-up, then we can detect if you have increases in blood pressure, if you have risk factors like if you have diabetes, if you're okay, if your weight gain's okay.
so you can
we
prepare
can
or...
we can prevent or help them diagnose it early. So hindi na po mag-ending sa ganun. Bad
Yung
ending.
nangyari sa story.
Opo.
Oh my gosh. So prenatal care is
Right,
basically
because
just
prenatal is actually educating
medical
the mother.
consult through
yeah.
education and medical
The do's
consult.
and don'ts.
The do's and don'ts.
And when they have to come for consultation, what medicines they have to take. And
Don't
whatever.
we have that program now, Doctora? We have this program with where we give money, CCT program, conditional cash transfer.
I don't think
Those are
that's-
one of the requirements. Prenatal,
Right.
going to school, education. The kids have to go to school. Requirement yan for the very poor to collect their 1,400 every month. Parang ganon. So that's why you're saying nag-increase na. Maybe that's one of the reasons. I mean, after all, we've spent a total of what, 120, 130 billion to date on this. And the CCT program must be linked to these health clinics sa mga libliban. Should be. Could be.
Right, but as far as the CCT is concerned, well, only those who go to the health centers are those are near or close to the health centers.
Malayo.
But if you are in the remote, which in the provinces, there are
it
so
could
many
be.
of them who are there very, very far, and they wouldn't care.
Yun ang problema.
Wouldn't care. So that is why the program for prenatal, all of these reproductive health, must be such that it has to be intensive, and money must be spent there, rather than money going into anyone else's pocket.
Correct. Yung simbahan, pagdating remote areas, mga libliban, alam mo, the best way to reach the people, hindi lang through the schools. Yung simbahan, kasi ang pinaka-pobre,
Because we go
lalabas
there.
yan para... Ang simbahan kasi talagang pinapasukan ng libliban eh.
We go there.
So kayo ang source of education, kaya lang
Missionaries.
kulang pa rin.
Kulang na kulang.
Kulang pa rin. Ilan lang kayong
Kulang na
pare to
kulang.
begin with.
Kulang na kulang.
Earlier, you mentioned that wala naman masyadong diferensya ang practice of the old obstetricians and the younger ones, except for technology. What exactly do you mean by that? Can you elaborate?
The technology.
Yeah,
It's
prenatal and
easier to diagnose diseases because of technology, imaging studies. It's you have a lot of options when you do operations. You don't need to have that big incisions anymore. You can have laparoscopic surgery with small incisions. There's even robotic surgery now
Robotic?
For CS, they do
yeah,
they do
not
that
CS, but
hysterectomy,
for
for
gynecologic surgeries they do in advanced hospitals. So technology really helps a lot.
And even the prenatal, right? Now you have, I think, regular ultrasounds.
Yes,
Even with,
and then
ordinary
congenital anomaly scannings, like we were talking about
scannings.
before. Before they didn't have that. Now we usually do it, and so we can detect if there's a anomaly
No surprises, in other words.
pre-delivery. So if there's something wrong, like with the heart or with the stomach, then we are ready when the baby comes out.
Ito, may dilemma ako, may question ako, maganda-ganda ito. Ito problema ng mayaman. They live here in the metropolises, in the cities, di ba mayaman eh? Di ba? Malaking bahay and whatnot. tuwing may buntis, someone's pregnant, they're about to give birth, they go to the hospital, they go to the doctor. Why is it almost 90% of the time cesarean? Hindi, bakit kaya? Kasi kaya kumita ang doktor?
Hindi naman po.
Of course you're gonna say, but please elaborate. Na bakit kaya? Sinasabi nila cesarean, di ba?
We have a lot of CS.
Odd,
already.
odd.
But not that much. But
Not
more.
much, but you know, before, there is no such thing as elective cesarean section.
Ngayon.
Now
Yeah,
there
but
are.
it is. It's elective now, Father.
That's right. Now there is.
Can we call this a dilemma? Hindi dapat, di ba?
You know what? As much as possible, it should be normal delivery.
Meron na iibaba sa normal sa cesarean. Kayo, doktor kayo, would you say, let's cut you up or let's
Is it
put you in the
safer
back room
to
and
do a
wait?
CS?
Hindi
or
po,
what?
may guidelines. We have
May
guidelines.
But is it safer? Is it better? Is one different from the other?
Of
On
course,
behalf of the
cesarean
baby
is more
and the mother?
risky. Of course, cesarean is more risky than normal delivery because in cesarean, you will have anesthesia. And of course, there
Pero
are
this is na
anesthetic
dilemma
risks.
ng mayaman nga eh. Cesarean! Yes, ma'am. Magkano yan? 120.
Maybe
Normal. Magkano
low-
yan? 5,000.
Maybe
Doon na
low
lang ako sa
threshold
normal.
to
Hindi
pain.
pwede.
Low threshold to pain. Kaya gusto nila yung labor pains
So,
hindi
dilemma
nila
ng-
kaya.
So, it is still more dangerous and it's not really promoted. Dapat, ethically,
Yes.
Yes.
to not have cesarean, dapat normal.
There are
Yes po.
indications to do cesarean section. In most of the hospitals, there is still a committee. There are indications and guidelines to do cesarean section. So, hindi naman po basang magse-cesarean kung walang
May
indikasyon.
ganun ba sa inyo,
But
doktora?
the hospital,
Pwede yun?
the hospital require you to first take a second opinion or what before the patient
hospital
before you
guides you?
decide.
We have
Whether
they
to
have
do
a
CS or
guidelines and
what?
protocols.
Pero, mayaman
But
ako,
all-
darating ako. Ayoko masaktan ng misis ko. Cesarean mo. Will you do it right away? Or,
Personally-
wait, i-test natin. Hindi naman kailangan. O, di ba?
Personally po, in my practice, I do not do elective cesarean
So, it's a
section.
moral issue on your part. Ethical.
For me, I do cesarean section for indicated cases, kung kailangan po.
Yun ang dilemma, Father.
Yeah, yeah. But you see, you have to go even further. Studies have shown that those who have been delivered through the cesarean section have low immune system of the baby.
Okay, baliktad.
So you have to go.
Coming
Go.
from
There
father,
are there are surveys.
Do you agree with
There
that?
are research.
Doctor? Tama
Yes.
yun.
Do you agree?
So, it
Oh,
has
say-
something to do with immunity.
Yes.
Oh my gosh.
That's why you are
Do
prone to
breastfeeding.
sickness.
And so
Not
I take
those
more
things,
pills.
those
Again,
things.
the
Father, I think
pharmaceutical wing.
not lower immune system, but sometimes cesarean section babies have a harder time to breathe a little bit because they were not pushed out through the vagina, the
Walang
small
stress,
intestine.
you mean?
Not
like that?
yung pong chest hindi napiga.
Yeah.
So mas medyo hirap huminga, pero yung pong
Ba't kailangan
immunity
mapiga yung chest?
sometimes yung mas
Bakit naman?
hindi pa para malabas yung mga secretions ng baby.
Ah,
So if
habang
you
lumalabas.
pass through the vaginal canal, mas maliit yung butas. May
But I have read about
Oo.
it. That's what
pero
is
po
being
yung
said.
immune system,
in the
hindi naman
research.
po ata.
In the
That's the
research.
normal birth has, there is a reason why masikip at lumalabas doon.
Yes.
Marunong na naman ang Diyos, no? Technology, inisahan na naman natin yung Diyos. Hiwain na lang yan! Di ba? Parang gano'n. And again, the pharmaceuticals win. Give him more meds. Give him more meds. Di ba? Parang gano'n. So actually, it's incorrect to, because now, I've heard talk, the 30s, those that get married. Oh, paano ka manganganak? No, cesarean ako. I will go in, para kang hotel, you check in, relax ka, tomorrow I'm gonna give birth. Hiwa, labas na naman. Parang
You can
gano'n.
choose your day of birth,
Oh.
your date.
Is that correct?
According to feng shui.
Is that correct?
We explain to the patients that are risk because once, especially the first baby, once you are cesarean, you're always cesarean
You're always
section.
cesarean.
And you are more prone to like placenta accreta, like that, more cesarean, so more scar, more complications. So it's very important that we deliver, at least try vaginal delivery on the first pregnancy. That's very
the
important.
Normal pregnancy, normal delivery, has less financial opportunity. Correct me if I'm wrong. I know it's a little touchy. No, is that correct, Irma? Dr. Irma? I mean, I know it's touchy issue. I hope you
Mas
don't
mahal
mind.
po
Of
ang
course, ang
bayad
cesarean.
ang cesarean.
Oo, mas malaking-
Kasi surgical po yun, nag-opera
Opo,
po
oo.
talaga. Oo.
But, so immoral yun. Sasabihin, kanyari pupunta sa isang hospital, gusto ko cesarean para hindi nasasaktan, hindi nahihirapan. Immoral pala yun.
There
Pag
is.
pumayag yung doktor, so dalawa silang immoral.
Dalawa sila.
Oh, I mean, in this case.
It's
know
always
what?
a patient's choice.
It's
really.
always
There is
the patient's
actually
choice.
patient
But it
choice.
shouldn't be the patient's choice.
shouldn't be the patient's
see,
choice.
I knew it. I agree with you. Dapat
Because
yung
we have
doktor.
to,
But as long
we
as
have
the
to,
doctors explain properly the pros and cons.
Eh, kung sabihin ko sa doktor, kaya ko naman magbayad, ano problema mo? Aawayin ka pa ngayon ng pasyente mo, di ba? Parang ganon.
in other words, things are done because I can pay.
Yeah, well, we already know how the world is made
Right.
of. Why do you think,
Right.
you know, why do you think Trump is winning in America?
But this elective scheduled
Yes.
first baby cesarean sections, we're talking about first baby. Yun pong sinasabi nyo na pupunta ako doon, parang check-in, maghihiwa.
Oo,
Most of the time po, repeat cesarean section yun. Pangalawa na po na CS.
Pag ganon,
Because pag ganon,
talagang
indicated
operahan.
talagang
Baka
operahan.
mag-rupture, there are
Oo.
complications
Pero po
associated.
yung sinasabi
First.
nating problema, yung first. Oo.
Can you actually pinpoint the day that I want my child to be born? Gusto ko at the pawn of the morning sun and whatnot at this time, di ba?
For repeat cesarean sections, we can't schedule
Yeah.
with a bracket of 1 week. We let them choose.
For
Scheduled cesarean for repeat.
repeat. Pero yung first, hindi
Usually
dapat.
po, mas maganda kung nagta-trial of labor. Try for vaginal birth.
Right.
Dami palang issues din to. No? Kala mo, it's just as easy as going to the hospital, you know, do it. We're out of here, di ba?
And another issue, although it's more on the legal side, is, for example, you delivered the first wife, no? And here comes again the doctor. The husband trusts the doctor so well
Pero
that
another
he
wife.
can mistress, or
Oo.
another, and the third and the fourth. May know, have you had experience like this?
Wait, are
Oh,
we
yes.
talking about era? We're not. Oh, we're not. Okay, I'm sorry. I thought we were going to the Manila elections. But go ahead.
Yeah.
Is that immoral? Iba-iba
Do you,
hawakan
do you
mo?
accept?
Kasi doktor
even
lang
though
naman
Yes,
yun.
yes. They are patients. They are
Yung nga ganun.
patients, yeah.
Kasi
Because
they
they
trust the
trust-
doctor. Oo.
We trust the doctor.
As
We
if there's
accept
no
them
other
as
OB
patients.
except
They trust you.
Uso po yun.
Your profession kasi has a lot to do with trust,
Kaya lang
confidence
po,
over years.
I will ask Dr. Sanchez, may mga medical
Susunod.
legal complications yung pag ginawa namin yun.
May legal
Well,
implications.
first of all, you are asked to sign, right? You can sign, but you can refuse also to sign
Ah, pwede
because
pala
it is
yun?
not a legitimate marriage or birth, di ba? Kasi,
Hindi
di ba?
ata tama legal yun. Ikaw what if we have to go back? Who is that doctor who gave birth to
The
me? And I'm the
doctor-
president
the
now of the
doctor-
country.
The
Hindi
doctor
pumirma
can
yung
do
doktor.
that, but the husband, whether he will affix his signature or not, is another
You mean the
issue.
father?
The father, yes.
Yeah, I've heard
Diba?
of...
Kasi in one case, totally different from the delivery is the fact that nagsu yung first wife.
Oh my
Oo,
God.
and the best proof is the birth certificate with the signature of the
Oo,
husband.
yun,
Di
truth.
ba?
May dilemma na naman.
Yes.
There is a dilemma.
Oh my
Certainly.
gosh.
But then sometimes before we encourage them to sign because that is for the benefit of the best
Yes,
interest
yes.
of the child. Diba? Lalo kung mayaman yung
Saka
tatay,
legal.
at least na-acknowledge siya, he will be an heir.
We're gonna have to end the show. You know, it's interesting. It feels like we just began, and already the time is clicking. Either that, or the cameraman's playing tricks on me because he's saying 1 minute to go, 2 minutes to go. You know, Dr. Belen, a quick message to our viewers. What would you want to tell them, very quickly, in 30 seconds to a minute? What message would you like to impart to our viewers?
To all our pregnant women, we will encourage you to go for prenatal checkup because this is prevention of mortality and morbidity during delivery. So whether you are young, you're old, find time to go to a good doctor that can give you good prenatal care.
Dr. Irma, a quick message to our viewers.
To all our viewers, it's good to, as Dr. said, it's good to have a annual OBGYN checkup, not only when you're pregnant. It starts when you have menstruation until after menopause, so 65. It's good to see a doctor at least once a year, have your pap smear done, have your breast exam done when you're already menopause, because early detection and good OBGYN care really helps all our women around the world. Thank you.
Alam mo, Dr. Tess, pwede na tayo kumuha ng sponsor sa hospital nila sa Batangas. Pwede na. Father Jerry, what would you impart with our viewers?
Well, You know, pregnancy is a beautiful gift given by God. And one of the most beautiful experiences of a woman is giving birth. Precisely the essence of a woman is giving life. So every woman must always welcome pregnancy.
Well said, Jesus. Well said, Father. Well, Dr.
Can I say
Tess.
my two cents word for people? You know, we always think of the child, what is best for the child, and sometimes fathers, even if they are, that's not their legitimate child, no, do sign at the back of the birth certificate. Well, there's nothing wrong with that, but there are other ways to acknowledge your child other than a birth certificate. Correct? Do you agree, Harry?
I agree. Well, ladies and gentlemen, we're going to have to end this show. So I'm going to say, Doctor, I am sick. Very quickly, give me a kid. Ladies and gentlemen, we hope you've enjoyed our program. We have Dr. Irma and Belen Rajagukguk. We have Father Jerry Manlangit and Tess Sanchez. We bring you medical dilemma to enlighten you, to bring critical thought into the living room, to make you understand not what just the doctors are going through, but the other issues that compound all of these different dilemmas in the world. Maraming salamat po. We hope you've enjoyed it. We'd like to thank St. Clair for really going out of its way to produce this show, to bring it to you, and to all the medical doctors, professionals. Thank God you're around. You are part of the nation's building effort. Maraming salamat po.
Medical Dilemma.